Hi again. Welcome to Boss Moves and Benefits. This is Ken Ball, president here at Custom Benefit Consultants, also known as CBC Benefit and Insurance Services. I'm also here along with my partner, the founder and CEO of CBC, Robin Ball. And our guest joining us today is Jigel Panilla, longtime employee here at CBC, the Director of Client Solutions and Compliance, emphasis on compliance. Because that's going to be our topic of the day. We're going to be talking about ACA impact. So the Affordable Care Act, one time known as Obamacare, because due to the timing, and it was kind of shepherded in and led by the Obama administration. But, the ACA has had an overarching impact on nearly everything that we do. It touches all aspects of employee benefits administrations, offerings, eligibility, plan designs, pricing. It really is woven throughout all things employee benefit plans. We think anytime that we have to make a change, contemplate a move relative to an offering, a vendor, a carrier, a plan, a product, it's one of the first things that we have to think about is making sure that we're compliant with ACA and everything that we do within it. And one of the fun and interesting parts of ACA that impacts us is it changes. So each year there are changes to the ACA. There's an evolution relative to certain aspects of it and how it touches employers, how it touches individuals, how it touches insurance carriers and their product offerings and their pricing. And then just for more fun, this year we had the One Big Beautiful Bill Act, and included within that act that we're all have at least heard of, if not familiar with, are certain provisions that impact ACA as well. So that's our topic for today. And I think in terms of focus, I look at it kind of as twofold, right? So what are the impacts on employers and what are the impacts on individuals who might be out there shopping? And certainly there's impacts on carriers and vendors and others, but, not to be, short about it, but, frankly, that's kind of their problem, right? Our charge is to help our clients, which are employers that want to offer benefits to their employees and individuals that are shopping. And so that's the lens that we're going to be looking at this through today, because, that's who we are trying to help. So before we dive in, I guess, Robin, I'll kick it to you. I guess, do you have anything else that you would kind of add to that descriptor, so to speak, at the beginning?
I don't think so. I think that, the big thing is just to educate our audience, on the trends that's happening. There's big moves in the individual marketplace that we're going to talk about that are happening in 2026. The minimum contribution is going up. So I think we should just get into it. And our goal is to inform you so you know exactly what's happening and what's on the horizon.
All right. So let's start high level, Jigel. I guess, certainly we can drill down and go down, any of these paths that we want to, but classic elevator speech. If you were stuck in an elevator with your big account and you had 30 seconds to kind of brief them on what to expect for ACA in 2026, where would you start?
So I'm going to step back outside of the big, beautiful bill and kind of just highlight the changes, right? So as you know, Tanner, you mentioned, so the federal government updates key limits every single year. And so those are things that we kind of keep a pulse on for year to year because it obviously impacts open enrollment, we offer payroll deductions, a whole host of things. So this year for 2026, right, we're already working on this year. This year for our brokers is 2026. So 2025 is kind of done and over from a broker perspective. But so for 2026, there are changes to the HSA contribution limits, which are very typical. I think now we're kind of accustomed that those contribution limits go up every year just a little bit. The high deductible plans, deductibles and out-of-pocket maximums have also actually been updated. Again, something that I sort of expect every year. and as well as how much you can contribute to an the high deductible health plans and HSA, how much you can contribute to your HSA. So obviously the close associated high deductible plans with HSA, but the HSA also has limits. So for example, on the HSA contributions, it's going up from $4,300 to $4,400 for 2026. And $8,550 to $8,750 for family for 2026. So a difference of $100 for individual and $200 for family. So also the high deductible plan in general, right? That the deductibles have also gone up, something that we also have to keep in mind with those plan designs to make sure we're updating out-of-pockets and deductibles accordingly in order to meet those high deductible plan guidelines. So the $1,650 plan, which is the minimum deductible to for a HSA, is now going up to $1,700, and the family deductible is $3,400 in 2026, where it used to be $3,300. Well, this year anyway, $2,300 for 2025, $3,400 for 2026. So again, these are things that when we're planning for open enrollment and looking at plan designs, these are something that we have to take in mind. As well as updating our enrollment systems and so forth.
Jigal, on the talking about embedded deductibles, do you want to briefly explain what embedded deductibles are? And maybe some large group employers, they might not have their plan designs embedded, and there's requirements for that. Let's drill down that a little bit.
All right. So going back to the minimum high deductible health plan, right? So an individual, if you're covered by yourself on a high deductible health plan at the minimum, your deductible, the individual deductible, will be $1,700. If it was a family, it would be $3,400, right? So in a family scenario, an individual in non-embedded plan would have to satisfy. So you have one sick individual within the family. That sick individual within the family, you'd have to potentially satisfy the entire family deductible, meaning that the first $3,400 of their health care will be paid by one single individual. Whereas when you embed a plan, then that individual only has to satisfy the individual deductible within that family unit. But there's also an FSA change on the dependent care and to the health FSA. So for the health FSA, I think we're accustomed to getting a little bit of a change every year. And in fact, it's changing again for 2026. We're going from $3,300 to $3,400, so an increase of $100 for the health FSA. Fun fact though, dependent care. So for dependent care, this limit has not changed since 1986. Actually, the program was formally, it's crazy. So
it would be interesting to show a chart of how much dependent care costs have changed since 1986.
Not keeping up with the times. Yeah.
So it's this one was surprising to me because again, for 30 plus years, this has been $5,000 has been the limit. So for 2026, happy to report that is a direct impact of the big, beautiful bill is that it's going from $5,000 to $7,500. So a substantial increase, right? And that is for single or family married filing jointly. Whereas if you're single and or married filing separately, you could each claim $3,750. So again, substantial. I think this is a permanent change. The only time that this was increased was during the COVID pandemic, but that was temporary. It got that down to the 5,000 level. And now starting with 2026, you will be able to contribute a lot more than what you've been able to contribute for the last 30 years. So,
I think another big part about that is that, you have kind of like the squish generation right now where you have children and you have baby boomers that are aging parents. And so both, can qualify for that dependent care reimbursement if you're providing care for them.
Agreed. And I mean, it's something that's become so expensive and unaffordable, honestly, well, 36 years. Yeah. So it's about time that they made an adjustment to that.
So one thing I want to take it back to is, one of the impacts that, really affect our clients. And when I am describing this, I'm speaking in particular about applicable large group employers, right? So typically defined or actually defined as having 50 or more full-time equivalents which there's, a whole other description that we could spend a whole podcast talking about, measurements and so forth, right? However, so under the assumption we're working with an applicable large group employer, they want to offer a plan that's compliant. There are several criteria that they have to meet, but at a very simple level, it has to meet minimum essential coverage values, and it has to be affordable. And the affordability threshold is the one that tends to change year over year. So just talk about affordability, Jigel, and the changes that we're seeing coming our way.
Yeah, so this is a sneaky one, right? Again, it's something that we have to keep in mind for open enrollment and all of our planning, and also taking consideration sort of the administrative burden and having to manage affordability. Whereas with a minimum value plan, you sort of said that I think the market in general, everybody's offering a value plan at least that meets minimum coverage. But the affordability aspect, I think, is one that obviously can change from year to year. They could definitely be meaningful, especially if you're, for example, in the restaurant industry or in the retail industry, casino industry, where you may have a lot of variable employees. Affordability becomes a very important issue and definitely something that you have to track on an annual basis. So this year we have, I think it's a 9.02 meeting in 2025, and it's going up to 9.96, which allows employers to sort of cost shift a little bit in order to increase. They got 34 employees. And maintain affordability on those plans.
So to be clear, there's several methods that meet the ACA requirements for determining affordability. We're talking about the W-2 income method, and in particular, that the employee's contribution towards the lowest cost plan as offered by their employer cannot exceed 9.02% of their W-2 income in 2025. Looking ahead to 2026, that increases to 9.96%. So a little bit of a moving target there, but something that employers need to have top of mind when they're pricing ahead of this year's open enrollment.
The other big thing that went up, and Jigel's kind of like our IRS dragon slayer, right? She takes care of all the nasty IRS notices that our employers get, but the penalties went up too.
They did go up. So something that we definitely have to, keep in mind. Those are really scary to receive those letters. Definitely something that we tackle and we help if we administrate your 1095C and ACA measuring process. But I think also, Ken, it's valuable to say to our employers, right, our groups, they've kind of got two different types of groups. One is where they decide to go with the lowest minimum, meaning the federal poverty level, and they calculate their employee premium for employee-only coverage and their least costly plans, so like a catastrophic high deductible plan, for example. They keep it to the poverty level amount. So again, ensuring that they don't run the risk that having a plan be unaffordable. Again, especially for retail, casinos, employers that have a lot of part-time or variable hour employees. So then the second option is that not to have a deduction that is below that amount. So again, not having that administrative burden of having to manage a W-2 and or just in general how much your employees are earning. So those are things that you can kind of look at when offering health insurance. Kind of rest easy to be able to know that your plans are affordable based on federal guidance. So to Robin's point, then the penalties are also going up. So the 4980 HA penalty, which is basically associated with minimum value coverage, is going up from $2,900 to $3,340. So again, that's a huge bump. But most carriers, again, or I should say almost all of them, and Ken, you can correct me if I'm wrong here, but they're all driving to that minimum value, right? Including preventative care. All of that is basically almost baked in by default to a fully insured market. On the self-funded side, we obviously have to work to make sure that those plans meet that value. So, definitely something that you have to think about when you're planning or designing your plans. And then the second penalty that is also going up is the 4980 HB, which is associated with both affordability and value. So again, those are two penalties. The B is going up from $43.50 to $5,010. Again, substantial increases. And then to Robin's point about the J226 letters, these are letters that you may receive from the IRS that they give you a timeline that you have to respond to them by. And these are typically triggered from an employee or with employees that are actually taking subsidy from a individual marketplace, or so definitely something that you want to pay attention to.
So you just context there real quick, when we were talking about affordability. So again, establishing that applicable large group employers must offer a plan that's affordable. They do that through one of three ways, which is the W-2 safe harbor, right? Which we established that's increasing to 9.96%. There's the rate of pay safe harbor, and then what Jigel just described, which is the federal poverty line safe harbor, which for 2026 is increasing rather to 128.99. Then looking ahead, part of the impact of that is, one of the services that we provide is, a robust ACA management, including all the IRS filings that are due at the end of the year, where we are, one, verifying that all of our plans are meet a minimum essential coverage guidelines, that they, two, are affordable, and that, three, every person that's rightfully eligible has been offered a plan in a timely fashion, and they have either enrolled or waived. All of those things, just a couple easy things, all of those things are required to avoid all those nasty penalties that Jigel described. And we certainly want to avoid those penalties because, as she described, they continue to increase year over year. I mean, they really have some teeth in them. The early first couple years of those ACA filing requirements, one, I think they knew and understood that there was a lot of moving parts here. There was a lot for us all to as an industry to collectively learn. How do we build the right technology to support the ongoing management of these offerings, and then oversee the submissions of the ACA filings in a manner that can be as efficient as possible. And now that's the expectation, right? So now the expectation is that we are all doing that. We're all actively doing that. And because it's the expectation, they're putting really big fines in place. Like it take a lot of mistakes to put yourself in a position to get fines in the 6 and 7 figures if you're, an applicable large group employer. Thus, the importance of really understanding this, and thus the importance of us having someone like Jigel who knows this stuff inside and out.
Yeah, I was going to comment on that too, because Jigel said, the biggest one, which she's right. Like, so you offered affordable coverage and one of your employees did not take it. They went to the marketplace, requested subsidy. And so now you're getting the big nasty letter. But the other thing, little issues that we find that will also get you the letter is managing your employee benefits and those codes correctly. And it might be payroll. I mean, large group employers, this happens all the time. Retro adjustments, retro terminations. You have lots of locations and you have different people inputting data into payroll. And so one of the things that we do really well, I think Jigel's team and our account managers, is we're looking at those warning signs. Our systems will tell us once we import payroll where the flashing red light is, to go ahead and resolve it then at that time in that month that it occurred. Also, we're looking at codes on any status changes. Somebody went from full-time to part-time to full-time. We had, QLEs, are those codes coming over right? So anything that would possibly trigger the IRS letter, we're resolving on a monthly basis. And that's made it a heck of a lot easier at the end of the year for us. We're not looking back for a full year and trying to find all of those things. We're auditing on a monthly basis. Jigel's been knocking it out of the park. I mean, our groups are ready first week of January, audited and done, so.
So if you're really interested in this topic, I think there's an awesome podcast about it on Boss Moves and Benefits.
There might be.
Yeah, we covered it in a lot of detail. And, not to steal the thunder of that other version, but I will anyways. Jigel, have any of our clients ever received a fine for their ACA filings?
None, zero. We've been able to address every single letter and resolve it. I mean, not only do we take that burden away from the employer, right? Because it is scary, but it's not scary just to forward the email and hope for and wait for the answer, right? But not only do we reply to the IRS, we call the IRS, make sure they received it, right? Because it's the IRS, it's the government. There's no assurity that they're going to receive it. So we fax it, we call, we verify, and we continue to follow up with them until it's resolved.
And to be clear, these letters can come to an employer through no fault of their own, right? So we can do every single thing that's required in terms of standing up the plans that are affordable and creditable, making sure that we're managing an efficient process to where everyone receives an offer. Those offers are documented, that we've got the right codes, we've done all the things. That doesn't stop someone from going to healthcare.gov and kind of working the system such that they can get a subsidy, right? And just that in and of itself can trigger the letter. So just to be clear, it's the system's imperfect. Thus, I think, the need to have someone like Jigel that has the back of the plan that's overseeing this thing start to finish and understands the ins and outs of the plan and all the requirements.
I think while we're on that affordability, I want to hit on ICHRA because ICHRA is really growing in the marketplace. And ICHRA is a plan where an employer can choose a contribution amount. If you're over 50 employees, that the contribution amount still has to be affordable, meaning that 9.96 that Jigel's talking about in 2026. But here's the catch, and depending on the locations where your employees are, the average median cost increase on individual plans is 18% in 2026. Some states as high as 35% in Arizona, for example, 21% in the state of Washington. A lot of carriers are pulling out of markets too. So I think anyone that's interested in an ICHRA plan, somebody that has an ICHRA plan today, we happen to have great Costco rates on our ICHRA plan. That's something to account for, that 9.96, if you were managing to 9.02 before and it goes to 9.96, that 9.96 is on average an 18% higher premium. So that is going to drive up the minimum contributions for ICHRA.
Yeah, so I think that's a good point, Robin. And so not to go too far afield of the topic, which is 2026 ACA impacts, but just to talk about kind of the nuts and bolts around ICHRA administration there, and in particular for groups that are over 50. When diving into ICHRA in particular, one of the part of the appeal is the flat contribution that you can establish on behalf of all your employees. But if you've got folks that are spread out over a diverse geographic area, and likewise that have a spread relative to their W-2 income, then you really have to dig in and understand the ICHRA impacts, because the applicable the salary and what's considered affordable in my zip is going to be different than Jigel's zip in Texas, and different than Florida, and different than New Mexico. And then when you have folks, you add on to that people that have different salaries. So it really requires drilling down to understand the affordability of every single person relative to their W-2 income and relative to the benchmark plan that's available to them in their particular zip. So we've spent a lot of time making sure that we understand this and can effectively guide people through that. And then there's, to your point, Robin, the impact of the ACA on individual markets looking ahead in 2026. So you mentioned it, but just to restate it, and so that we're clear, the individual market is set to really feel the brunt of some meaningful increases this year. So 18 to 20% on average increase across the nation. We're hearing that in some markets, this is going to be 30, 40% or more. That's really going to impact folks that are on individual plans today, let alone someone that might want to offer an ICHRA to their employer-sponsored plan. And I think one thing that I'm afraid of as well is that it could drive carriers out of the market. And then that's just the kind of, for lack of a better description, the gross cost, right? So when we think about individuals that are out there shopping for ACA plans, and in particular, on what we call on exchange, which is on healthcare.gov or your state-sponsored marketplace, that's where people have the opportunity to receive federal subsidies. However, part of those federal subsidies are enhanced tax credits, right? And those are set to expire December 31st, 2025. So that means that a lot of the subsidies that we receive today or that individuals receive today are going to go away. So we talk about the gross cost is going up by 18 to 20%. The net cost after you get subsidies could likely increase as well because of some of those premium tax credits or the tax credits that are sunsetting this coming year.
I think it's a really good time to shop if you're a small group employer and maybe you haven't wanted to put a plan together or couldn't afford to put a plan together and everybody's on individual plans. Some are going to be on those premium tax credits that Ken's talking about. Everybody's going to get a big increase. The small group market is not going in that same direction. So you might be able to save money for everybody and make it more affordable if you look at small group plans.
However, time is going to be of the essence, right? Because the open enrollment window is going to be shorter this year for individuals. We also know that 80+% of small group employers are shopping during that December, probably November 1st, December 1st timeframe. So it's a busy time of year. Anyone out there that works in our industry, we all brace for the fourth quarter and know what it brings in terms of the volume of work and the types of activity that we have to be prepared to support. And then when you think about it this year, again, within the context of things keep changing, and that means, different premiums, different carriers, and the ability to support folks that are shopping.
So, one thing that we didn't ask you when you came on, and I know we might have hit it in some previous podcasts because you will be a familiar face to our listeners, but why have you been with CBC for 25 years? You moved away from Las Vegas. We couldn't get you back.
I did. I was the first remote employee before what was even a thing. So 17 years that I've been working remotely from Texas. But yes, I started in Las Vegas. I don't know. I've worked obviously in other places, corporate America. There's nothing like CBC. I mean, it's the family, it's the support. And I feel like that there's no red tape binding us, right? It really is no red tape. There is no department. I mean, I work with TPAs and you have to, I have to talk to this department and it takes days to get a reply, or I have to talk to this department. I had to literally call Sheila or Candace or any of my colleagues in other departments per se and get stuff done within minutes. So it's really helpful to feel accomplished on a day-to-day basis and be able to impact that experience of our clients swiftly and quickly. But outside of being able to service our clients, I'm very service oriented. So it's always been about our clients and what we provide them, which I think we truly are customer service oriented or client oriented. I don't even know, at this point, why we call them clients. I think they ultimately become our friends through our experience because we do a lot for them. So our interactions with them is not just at open enrollment or open enrollment planning. It's something that we work throughout the year, every day, constantly with each of our clients, depending on their needs. But it's just that relationship that we build with each of them. And all of them have been really long-term clients. Many of which have come back to us even after they leave their positions and take other positions. They come back to us just because of, again, the experience in those relationships that we're able to build. But outside of our clients, it's just, again, working for CBC. I think we feel like we're all part of a family. I can go to Robin as same as I can go to any of our colleagues and talk to them and get things resolved. Although we have job descriptions, I don't think any of us is not willing to do something for somebody else, regardless of a job description or not. So, all of those things, I think it keeps me here.
Well, I like to hear that, but Jigel, just to tease you, sometimes you call it blood money.
Yes, it's become blood money. I'm like, I want little burgers, Want to go back to Burger King when I was 16 and just flip those.
Yeah, she does say that too. Sometimes our industry is challenging, and our cast of characters and our team is pretty strong all the way across the board, from individual to large enterprise, leave. Our TPA side, like there's no place internally. We have in-house risk counsel. There's really no place we can't go for the answer. So. Super proud about that. And thank you for that answer. I had to tease you a little bit.
I mean, we're always starting to think outside of the box and, just turn things upside down and just take the market and make it different and new and leverage relationships. So, all of that just makes it really, really hard, but you have to learn things constantly because we're always trying to stay ahead of the game. So, yeah, it's fun.
It's fine.
Yeah, it's certainly always changing.
You're not bored.
No, never bored.
So just some closing thoughts, Jigel. Again, any other thoughts, recommendations, tidbits on ACA in 2026?
Well, just in general. I mean, if you need help, we're happy to even answer general questions. If you need just to call somebody for expert help or you wanted, bounce back to something that you might have heard or we're here to help. Honestly, we just love sharing our knowledge and experience. And if you're doing ACA alone, it really, think you're going to muddle through all the rules and regulations. It's going to be inexpensive to have somebody else manage it for you to take that burden off your shoulders, especially compared to those penalties. So we'd be more than happy to help. Just call us if there's anything that you need or have any questions. We'd be more than happy to just help.
How about you, Robin? Any other closing ACA 2026 thoughts?
No, I think that, pay attention, especially if you're a small, mid-size, employer, you might not have the expertise that we're talking about right now, but that's a lot to take in, right? Do you have an embedded deductible? What does it have to go up into? How do you know that you're compliant with that 9.96? All of those things, are really important to look at every single one. And I think communication to your employees, right? Let them know what's happening in the market early. I would say brush up on that dependent FSA. That's $2,000. Let the employees know what that can be used for, because that's kind of a loss leader. It hasn't changed in a long time. And a lot of people don't know that they can do elderly dependent care as well on it. So I think that's a big buzzword right now too. So pay attention.
So yeah. I think the takeaway, listening to both of you in your closing remarks, is that's what we're here for. So, we spend our days and nights staying up to speed on all things employee benefits. And as we kicked off this episode with, that means we have to be experts on ACA. There's no ifs, ands, or buts and no ways around it. We're here to be your resource. And so hopefully you learned a little bit of something on this episode of Boss Moves and Benefits. If not, give us a call and we'll bring you up to speed.
Bye, Jacinda.
Bye. Good to have you.